Welcome students to R.A.T.S and Pathology. We shall be continuing with bone and joints, and for today's class I have chosen a couple of short notes, difficult for the students but important in the examination. The first one is Paget's disease of the bone. Please be careful with the words. There is another disease, Paget's disease of the breast, that is also asked for you as a university question. We should not interchange and write. This is also called as osteitis deformans. It is a disordered proliferation resulting in a structurally ineffective bone. Ineffective in the sense it is not able to support. And it is also described as 3 M's. What are the 3 M's? Metabolic, matrix, madness. Please remember this. Disordered proliferation, metabolic, matrix, madness. There are 3 stages of the disease, namely osteolytic and osteoblastic combined, osteosclerotic or burnt out. It was first identified by Sir James Paget, a British surgeon and pathologist. More than 100 years back, that is nearly 130 years back, he suggested a viral etiology as a cause of the disease. And probably paramyxovirus was the causative agent. And over the century, there were many debates and counter debates, various suggestions, and now ultimately people have agreed that it is because of a viral infection, probably respiratory syncytial virus or a measles virus. And in all these, you find that there is a microcylindric inclusions that can be found in the lesion. The age and cause. Age, it is uncommon below 40 years, more common after 50 to 60 years, and it grows progressively. The distribution is common in Europe and America, uncommon in Asia. One thing that we should remember is the RANKL. What is this RANKL? Receptor activation of nuclear factor for the kappa light chain of the B cell. Very long, but we shall remember it is important and it can be an MCQ for us. RANKL. Regarding the types, there are basically 2 types of Paget's disease. One is monoostotic, other is polyostotic. Monoostotic means a single bone is affected. Polyostotic, multiple bones are affected. And what are the bones that are affected in Paget's? It will be the central axis. Let us remember the central axis mainly. That means spine, pelvis, skull. This is one. Other bones can be the femur and the tibia. And in this picture, I am finding a very haphazard laying down of the new bone. These are the osteocytes and these are mosaic lines, and the bony trabeculae are being demarcated. We shall explain the stages. First is osteolytic, which means there is a disordered resorption of bone. There are 2 cells basically, the osteoclast and the osteoblast in the bone. The osteoclast helps in removing the unwanted bone, whereas the osteoblast lays down new bony matrix. In this stage, you find that there is a disordered removal by the osteoclast. The next stage is a combined osteolytic and an osteoblastic stage. There is resorption as well as haphazard laying down of woven bone. Both are there simultaneously, and it produces a mosaic-like picture in the bony tissue. The last one is the osteosclerotic stage, which is almost a burnt out, the end stage. But then the bone that has been formed is disordered and poorly supported. It is prone for fractures. 3 stages, please remember. And I'm again showing you this picture for the sake of understanding. If you do not understand, please compare this bony tissue with this. This is the normal bony trabeculae that is there in us. You find that the cells that are rimming it are the osteoblasts, and they lay down the new bone. These are the osteocytes. Such a structure is not seen in a case of Paget's. What are the manifestations of the Paget's disease? One will be pathological fractures. Though there is a thickening, there can be a fracture of the bone. Bowing of the bones, bending. The femur can be almost at right angle in the side of the neck. The skull, there is a Leonitis ossea. Thickening of the bone will lead to a change producing a lion-like skull. The bones are heavy. There is a narrowing of the foramina. In the vertebrae, there is kyphoscoliosis, forward or lateral bending, paraplegia due to compression. And the same points are mentioned here. Another one is flattening of the base of the skull, producing a platybasia. One of the nerves that can be compressed will be the 8th cranial nerve. A point of importance will be the malignant transformation. Osteosarcoma and fibrosarcoma can develop in patients who have got Paget's. The type of osteosarcoma here is called a secondary osteosarcoma. So the diagram of the Paget's, and here you see the skull. This is the inner and the outer table. You find between that there is laying down of the bony material leading to widening of the diploe. And there is also an increase in the size of the skull. So what happens as a result of this? The patient keeps repeatedly changing his hat. These are given in your Bailey in Love, the textbook of surgery. This is an important question for you in surgery as well as orthopedics. And this picture shows a pagetoid bone developing a pathological fracture and is also prone for osteogenic sarcoma. The bowing of the bones we had mentioned. Look at this one. The bones have become almost C-shaped. There is a bend of the bone. The tibia is one of the bones that can be affected. It is very coarse and it is called a sabre tibia, S-A-B-R-E. It is seen in conditions such as Paget's disease as well as syphilis. As a summary of the Paget's, we shall be seeing the definition, what are the types of it, the causes for Paget's, the manifestations, what are the bones that are affected, and the stages. This is particularly important. The 3 stages we will have to mention. The complications, which can include compression of the nerves, pathological fractures, or malignant transformation. And the next topic for the day is gout. This again is a short note, a little complex, but we shall see how we can deal with it. Gout itself is not a disease. It is a generic term. Generic is a generalized term that is used for varied disorders that are not related to each other. You will see that when you see the cause. There are a number of disorders which are not related to each other, and that is also described as disparate. Disparate means varied. The common manifestations in gout are four things. 1. Hyperuricemia. 2. Acute arthritis. 3. Asymptomatic intervals between the attacks. And 4. A chronic tophaceous gout. 4 stages you shall remember. And this is a mnemonic I picked up from the net. A common bone that can be affected is the great toe. One joint is usually involved in most cases. Uric acid crystals and urolithiasis, this will be the culprit. And tophi, this is a lesion seen in chronic gout. GOUT, this mnemonic you shall remember. And this is a picture of an acute gout. You can see that there is a swelling, there is a redness, there is a stretching of the skin. Obviously, all the signs of inflammation are there, and the patient will be having excruciating pain, which is depicted in a picture over here. Look at this, the harm that is being created onto a joint. The causes for gout are divided into the primary gout and the secondary causes. The primary causes, primary means usually we do not know, but then there can be some underlying conditions such as hyperuricemia. After all, uric acid is being produced, so there is hyperuricemia. Males are more prone. Obesity and insulin resistance go hand in hand with gout. Alcohol can induce a gout. A purine-rich diet and a defect in the uric acid metabolism are the most important features which can lead to gout. There is a disorder called as the Lesch-Nyhan syndrome, in which there can be a gout. Along with that, there can be other features which we shall be seeing. So these are all the primary causes for gout. Please read them. Secondary, two things we shall be remembering. One is a renal disorder. Any chronic kidney disease, because of the impaired excretion of the uric acid, can lead to gout. The second one is a myeloproliferative disorder or any malignancy. All the nuclei can lead to uric acid. So whenever there is a condition with increased nucleic acid turnover, there will be a gout, and that includes malignancies and leukemias. This is a picture of the gout. So compared to the first picture, you find that there is no redness over here. Of course, the swelling is here. It is not as painful as the original one. This is called a gouty tophus. And this is a diagram of it. This is a joint space in which I am seeing the monosodium urate crystals. And as a result of which there is a deposition of amorphous material, which is the tophus. Amorphous material is deposited. This can destroy the joint surface. Tophus is another word that can be used in conditions such as rheumatoid arthritis also. Please remember. You people can draw this diagram. The manifestations of gout. There is an acute arthritis, severe, unbearable pain. There is outpouring of the leukocytes. When you study under the microscope, a lot of neutrophils will be there. And these are all because of the crystals of monosodium urate. The leukocytes are attracted towards it. These crystals are long, needle-shaped, birefringent. And when you see it in a HNE, they are non-staining. They appear plain. And all the inflammation is because of the Hedgeman factor and the other inflammatory mediators which we had studied in the first chapters. The sites that can be affected are the great toe, the ankle, the lower extremity mainly. If it is chronic, you find that there can be a disabling renal disorder as well as a disabling arthropathy. In chronic arthritis, so this is called a pannus. It can be seen in some sites such as the digits and the joints. The ear lobule is another site where we can get a gouty tophus. And there is a precipitation of the urate. Initially, they cover the joint surface. This is followed by the proliferation of the synovial cells and the formation of pannus. What is pannus? It is nothing but acellular material that is deposited around crystals such as monosodium urate. Finally, if it is not treated, the underlying bone is also destroyed. These are the inflammatory cells. We will again be seeing a picture of this. Lymphocytes, macrophages, and the giant cells. The sites we had mentioned, I will not be repeating. Apart from the skeletal system, other organs can be affected, namely the kidney. In the kidney, two things can happen. One is nephrolithiasis. Nephrolithiasis means formation of stones due to uric acid. And also there is an affection of the interstitium. Interstitium is the supporting tissue. That is also damaged. That is called uric acid nephropathy. And tophus, incidentally, the Latin word means stone. So it is a stone-like lesion that we are seeing in gout. Look at the slide, a histological slide. The three arrows I have drawn, please follow them. This is the acellular space in which I am finding, if you can observe, there are some needle-shaped structures. So this is the tophus. Around that, I find multinucleated giant cells. See the number of nuclei. Multinucleated giant cells. There are also other large cells which are seen throughout. They are the histiocytes. So it is given here, giant cell, histiocyte, and the pannus. Please remember this in histology. You need not draw, but you can mention these. This is a normal uric acid metabolism. I am not going into it. In this condition, you find there are two lesions basically. One is an increased amount of turnover of cells which can produce increased nucleic acid, and then the metabolism. And finally, you find that there is uric acid excess, which can lead to a gout. The second condition is when there is an impaired renal excretion. When there is impaired renal excretion, uric acid is retained. This again leads to uric acid crystals and gout. So this is a normal metabolism, and here you find these are the abnormalities. Remember these two things in the boxes. A differential diagnosis, you will score a mark if you people write pseudo gout. What is the pseudo gout? Gout we have already seen. We see birefringent crystals. Here it is pink in color. And the crystals are needle shaped, whereas here they are rhomboid or rectangular. Monosodium urate, whereas here it is calcium pyrophosphate. Found in the small joints such as the big toe, this is mainly found in the knee joint. So these are the differences. Even otherwise, remember that there is a condition called pseudo gout. What can be the investigations? Main things alone we shall remember. Joint aspirate will be showing monosodium urate crystals, which can be demonstrated by using a microscope called polarizing microscope. So this is very, very, very important. We'll have to answer. The renal function is affected, so renal function test will be abnormal. When you examine the patient, there may be a tumor or there may be a leukemia. we'll have to look for these. The increase in WBCs and ESR is an incidental finding which is not very specific. So again repeat, urate crystals, polarizing microscope, abnormal renal functions, and presence of a leukemia. Radiology is very important, in which I can find that there can be an erosion of a bone, and the blue arrow points to the deposition called as topus. So radiology, and here I find a club-shaped expansion of the bone. A word about the syndrome called the Lesch-Nyhan syndrome. It affects a patient who has got a little bit of personality disorder associated with hypoxanthine guanine phosphoribosyl transferase. So he is a hyperactive person. He has had a habit of self-mutilation, and there is chorioathetosis. Random purposeless movements are there. These are the features of Lesch-Nyhan syndrome. And we are coming to the close. Before that, this is a brook. Men may come and men may go, but I go on forever. A very nice poem that has been written by Alfred Lord Tennyson, The Brook. Mercy.